going on, Apex family? We're here today to talk about the step down. I know a lot of you probably utilize step ups in your weight training or other activities, but today we want to highlight 4 ways you can implement step downs to improve lower body endurance, coordination, and mobility. Stay tuned. All right, guys, I've got Dr. John here with me, Doctor of Physical Therapy here at Apex Performance Wellness and Rehab. He's a board-certified sports and orthopedic specialist and a level 2 track and field throws coach. I'm Jaron Mastrew, former NFL tight end. I've had a couple of knee surgeries, I've had an ankle surgery, so today's conversation is really going to be helpful for me and other people out there that have had some of these similar issues or just want to bulletproof your body in a couple different ways. John, before we get started though, touch on some of the precautions with these movements.
Hi everyone, I'm John. So with any exercise program that we're giving you here, we're talking about the basics of each component. So if you have any severe pain or injuries from the past that may limit you with these things, make sure you reach out and talk to us so we can make sure we give you better guidelines on how to do these things. The exercises we're going to show you today are the baseline level of step downs in different versions and how you can use them to try and get different parts of your body to be better. All right?
Great, so we have about a 9-inch step here. There are also 6-inch steps and smaller steps, so just beware that when you start off with this, start smaller and work your way up. As I said, I've done some of these before, so we're going to start off with this one. We're going to start with the most basic version that some of you probably already done, just the regular step down. So I'll get in the position and I'll let John take it away from here.
Okay. So Jaron's going to position himself with 1 foot off this there. He's going to keep his foot nice and flat like that. So he's going to bend his hip and his knee and try to touch his heel to the ground. Control. Good. So this is the basic step down or heel tap. So the point of this is to build that one leg squat strength. This is a very good precursor if you want to ever do like a pistol squat. So what you should see is he's going to nice hinge at his hip, so he's going to get into his posterior chain, his glutes. His knee's going to come straight towards me. Good. Just tapping his heel and coming back up. Jaron, can you face forward?
Talk about the speed here, because sometimes I feel like I want to go faster. Should I go slower? What's the tempo like with this?
So typically, just to get used to an exercise, I like a 1 second down, 1 second up tempo. It's easy to remember, and it's slow enough to get some control, but fast enough to get a little bit of concentric movement out of it. So ways you can manipulate any of these exercises is to do a slower count on the way down. So we're going to challenge here, and he's going to try to go 3 seconds. 1, 2, 3, fast. Woo! Good. So what that does is it works the muscles over a longer period of tension. And time under tension helps you build strength, helps you build muscle size. It's typically used with a lot of bodybuilding type ideas to make long amounts of time with each exercise.
And with this basic step down, where should I be feeling it the most? Hip, glute, quad, ankle?
Great question. It can be all of the above. I think the average person will feel it mostly in the quad muscle, which is your engine for your knee. So it's the one that straightens your knee from a bent position. You should also feel it kind of in the side butt here, because that's controlling your pelvis from being tilted. So let's see if he's actually doing a good job. So he's actually getting a little bit of pelvic drop. You can see that. Try it again. See if you get.
Ooh, I'm burning a little bit. All right, here we go.
Okay. It's a little better. He's still dropping down. So you've had.
I feel that.
So you had an injury in this ankle before, right?
I have. I had a stress fracture in this ankle and had a surgery. I have a pin in it right now.
So you have any kind of weakness of the ankle going forward, so right now his ankle's going forward to lower himself down, or some tightness, you can oftentimes see that hip drop on the other side to try and compensate for it. So possibly, when he's tired, he may need a lower step, or he just got to, try harder.
Let's move on to the set. Do you have any other points for that one?
No. So again, the idea is, actually try one more. So another thing to watch, so as he's going down, where's his knee going? So ideally, it's going straight out over his foot towards the camera here.
It really wants to do this.
Yeah, so that caving in is, again, part of that pelvis drop or internal rotation of the right leg. So there used to be a lot of talk about controlling that position because maybe it had something to do with like ACL injuries, possibly kneecap pain. Don't let a non-perfect rep prevent you from doing it. We're always trying to have perfection with each rep. It's not possible typically. So progress is always more important than perfection.
All right. Well, what's the next version we got?
We're going to move to a backwards reach on the step down. So let me have you face sideways again. So I'm going to come around the other side here. So now what Jaren's going to do is reach backwards a little bit as he steps down.
And how far back am I aiming?
Start like 6 to 8 inches, so small one. You see he gets a nice good lean at the trunk here, so leg going back. Let's try a little bigger one. The trunk one. There you go. So that's a hard one right there. So that's a little more advanced. So, but he had a really good hinge of his hips. So what that's going to do is going to help you recruit the butt muscles to help come back out of the hole because you get a stretch of the butt muscles.
I definitely feel it more in the glute and in the ankle.
So again, the deeper range you go, the more your ankle bends, which is probably why he's feeling it there.
Try one on this side.
Good. So you had a nice line from his shoulder to his foot, that's what you're trying to aim for.
Now, is it normal for people to feel a difference from one side to the other?
Quite possibly. Everyone's asymmetrical. Everyone has injuries playing sports growing up or accidents. No one's symmetrical, so it's very common to feel with each side, whether it's an upper body or lower body exercise, a difference doing things. Okay, so I really like this one too. So say if you're doing the regular step down, it's really bothering the front of your knees, I would try a step back to see if that puts more force into your hip and it takes away some of that discomfort in your knee. Now let's show the step forward, the reach forward.
And how far forward are we aiming on?
Again, start small on this one. This one's always harder. This is the hardest one.
My knee's definitely wanting to buckle in here.
Yep. So he feels it by his knee. So when you reach forward, it does put more stress on the knee. This is typically a limiting factor for people who have a hard time going downstairs. That control the thigh muscle with the knee going over the toes as you go down. So a forward reach, you're trying to keep your heel flat. He's doing a good job there. What that causes is a bigger movement of his shin going forward. So it's going to put more stress on his quad eccentrically. And it actually helps with the ankle too. So you start to get a little more mobility with the shin going forward. So that ankle dorsiflexion, as we call it, which can be oftentimes a contributor to other things in the body because you lack it. It helps you get into deep squats, helps you get into deep lunges. If you're lacking the dorsiflexion, you're going to compensate typically somewhere.
Now, if you're feeling pretty good with these, do you ever alternate from the back tap to the forward tap?
You certainly could if you want to add a little more variety. You could even do 3. You can go back, straight down, and forward to give yourself a new challenge. Good. I'll challenge you a little bit. Never come all the way back up straight. Feel a little bit of tension. What do you feel doing that?
More of a burn in the quad, that's for sure.
So if you're looking for that time under tension that we talked about for your quad, you can cut short that range of motion just a skosh. That's going to cause a constant tension on the thigh.
Now those are 3 common ones that most people are probably seeing. What's this last one that we have in store?
The last one is going to be the curtsy reach. So for this, we're trying to get into your hip rotators and also into a little bit of the medial ankle muscles. Okay, so he's reaching diagonally back behind him. He's trying to keep his hips and his shoulders square. Good.
And I'm probably guessing it's the same theme as the first few. Start small and go farther with each rep.
Exactly. Start with what you can control. If you feel like you reach 5 inches and you can do that, but you try to reach 7 to the side, and all of a sudden you're falling over, stay at that 5 until you build up a little more endurance, then you can try to go a little bit more. So when he does this exercise, are you feeling your outer hip kicking here a little
I'm definitely feeling this one. This I feel most in my hip.
Yep. So by causing that reach, you're going to get into your outer hip muscles a bit more. It causes a bigger stretch in them, and they got to pull you back up. So you get a lot more of your rotary muscles in your hip. Which is a very good one for people after knee injuries where they're trying to control their kneecaps. Basically, you're building tolerance to kind of awkward positions with this step down.
I'm also feeling in my ankle in a little different way than the other ones.
How so?
I'm feeling a little more on the inside.
Yeah. So there's a muscle along the inside of your shin that goes down to your foot called your posterior tibialis. It is responsible for controlling your arch. So when you want to reach back to the corner, a lot of times your body wants to go this way or lose control of your foot. So those muscles on the inside and outside of your shin are going to work together to keep a nice balanced foot, which is important for every lower body movement. Okay, so come here in front, Jaren. So we talked about if the stair is too big, you can start some of these on the ground. So let's say it just hurts your knee too bad to do like a 6 or 9 inch stair. You can start on the ground with some of these basic movements. So you could, so come right here in front. So we're going to start with a little backwards reach. So there. So he's stepping a half a step back. He's getting a nice hinge at the hips, a nice line from his ankle to his shoulders.
I'm still feeling that in the glute.
Yep. So that's a good way to kind of substitute, even if you don't have a stair, you just want to do some of these things at home anyways. You can do the backwards, the forwards, and the curtsy without having a stair and still get a good workout in. So this is always a hard exercise too, especially after knee injuries. We want to build up that quad. The quad is your engine for your knee. We know it needs to be strong to get back to sport after ACL injury or any kind of meniscus injury. The quad is the king.
Well, John's given you a lot of good ways you can utilize the step or the ground to improve lower body coordination, mobility, and endurance. Go get after these today. And if you have any questions, concerns, comments, you can drop them below or hit us up. We can always give you a virtual appointment, help you assess things, and make sure you have the right prescription to help you and your body and help you reach your goals. Don't be afraid, and we look forward to seeing you on the next video.